Good afternoon for those of you who are on the East Coast, and good morning to those on the West Coast. I want to thank everyone for joining us today. My name is Alana Silber, and I am the Executive Director of Sharsheret. Just to make sure you're in the right place, this is Sharsheret's weekly webinar series to update you on critical information for you as someone who is living with breast or ovarian cancer or caring for someone who is. I just want to remind everyone that we're on a group call with lots of people, so please remain on mute. Also, we are recording this so that others can access it at another time. So if you'd like to remain anonymous, you can change the name on your screen. You can turn off your video. You will only see the speaker, but for extra privacy during the call, feel free to maintain your anonymity. I'm really excited to see you here today, which means you are well enough to join us. So first and foremost, your health and your safety is a priority. So that's what these calls are about. And Sharsheret offers resources and information and support all virtually, all by phone and by email. So if there are other issues that you are dealing with, Sharsheret has a team of social workers and a genetic counselor who are available and eager to speak with you about your personal issues and concerns. We have been doing this for 18 years, and the circumstances are different, but Sharsheret is prepared and eager to help you when you need us most. I'm privileged to have with us today two incredible people. We have Dr. Arthur Reingold, who is Division Head of Epidemiology and Biostatistics at the University of California, Berkeley School of Public Health. He also has worked for over 40 years on the prevention and control of infectious diseases, both at the national level, including 8 years at the CDC, as well as with numerous developing countries around the world. He's directed or co-directed the CDC-funded California Emerging Infections Program since inception in 1994. And we have Dr. Marisa Weiss, who is the Chief Medical Officer, founder, and visionary of breastcancer.org, an incredible website. If you have not been there, I encourage you to go there when you have questions, when you have concerns. Everything on that website is reliable. Sharsheret turns to breastcancer.org very often for our resources. Dr. Weiss is also the Director of Breast Radiation Oncology and Director of Breast Health Outreach at Lankino Medical Center. We also have sponsors for these webinars, so we can keep them coming, to the Sigmund and Edith Blumenthal Memorial Fund, Seattle Genetics, and we're in partnership with breastcancer.org. So now it is my pleasure to turn the floor over to Dr. Reingold.
Well, good afternoon. Can you hear me okay? Yes? You can hear me? Alana?
Yes, we can. Thank you.
Yes.
Okay, just checking because I'm not muted, so you should be able to hear me. So I'm delighted to be able to be with you and to see if I can be of any help. I generally find in these types of sessions that the less speechifying I do and the more answering questions that are on people's minds, the more useful the time is. So I'm not giving a PowerPoint presentation. I'm not giving a big lecture the way I have to do it at work. But I'm just going to make a few points of introduction. And I want to begin by saying that there are lots of things that are challenging about the current times, but one of the good things is that pretty much anybody with access to the internet can remain quite up to date about this rapidly evolving disease and situation. The World Health Organization, the CDC have excellent websites, and frankly, one of the better sources of information on a daily basis is the New York Times, which is making its COVID-19 information available, I believe, for free, even to non-subscribers. So I rely on all those sources in addition to medical journals to stay up to date, and there's no reason why people can't access that information themselves. And I think the other thing I just want to start out with is anything I say today will be out of date by tomorrow. So that's one of the complexities, is that this is such a rapidly evolving situation that you do need to sort of stay up to date and not rely on anything anybody told you in a given day. So just to briefly recapitulate where we are here at the end of April, it was only 6 months ago, even less than 6 months ago, when this new virus originated, we think, in China, almost certainly coming from a bat or perhaps another mammalian species, and making it into human beings, and then unfortunately being easy to transmit from one person to another. So we have lots of information that tells us that this may have all gone back to a single animal to human event, transmission of this novel coronavirus. And just in a remarkably short period of time, we now have, these counts are wildly underestimates, but at least 3 million cases globally, and at least 200,000 deaths globally, with a third of those cases and a half of those deaths in the United States. Or a quarter of those deaths rather in the United States. But every day the numbers will go up, and we know the numbers are a gross underestimate of how many people have been infected with the virus, and almost certainly an underestimate of the number of people who have died. So as you all know, the world is scrambling to keep people safe, to understand how we can best do that while we await a hoped for vaccine and better treatments. And so a lot of the emphasis to date has been on social distancing maneuvers, trying to keep yourself from being infected in the first place. And that's particularly important for people with underlying illnesses, such as cancer or heart disease or lung disease, or for the frail elderly, particularly people living in congregate settings, such as nursing homes and other shared facilities, where a staff member or a visitor can inadvertently introduce the virus, and it can spread very quickly with devastating results. So, as you all know, our society and societies around the world have been upended. Our economic situation has greatly worsened. Lots and lots of people are out of work. Kids are not in school. Large events are all canceled. So this is having a huge effect on our society. Some of us are lucky to have jobs where we can work at home without much disruption, but others clearly are unable to do that. So we really don't know yet which treatments will be effective. I haven't been a clinician for several decades, but it looks like we do have a good clinician on the call, and maybe she can speak more about the therapies, but none of the therapies is yet proven to be effective for coronavirus 19, number one, or COVID-19 rather. And as everyone knows, the optimistic projections are that we might have a vaccine in 12 to 18 months, although having one that's shown to be effective is one thing, having 1 billion or 2 billion doses of a vaccine for widespread distribution is quite a different thing. So in the meantime, we're all doing our best through standard public health measures to keep people safe. And I'd be happy to talk about those measures and what we know about them. But I suspect that would be better done in the context of questions that people have about social distancing, about masks, about all the other things that you've heard about. So let me end there, because I really do think the more time for discussion and questions, the better.
Thank you, Dr. Reingold. I'm now going to turn over the floor to Dr. Marisa Weiss.
Well, thank you for having me participate in this call and to meet all of you and to work with Dr. Reingold. That's a pleasure. Thank you. So as Chief Medical Officer of breastcancer.org, open 24/7, 365, we're certainly hearing from our audience of now 19 million people about how much this pandemic is completely upending their lives. I mean, just causing chaos and a real crisis for each individual in so many different ways. For those people who, for example, were diagnosed with breast cancer, their ability to have surgery is completely constrained. People who even have significant disease or stage of disease have had their surgeries postponed, and meanwhile they're being put on an interim method of treatment like anti-estrogen therapy or anti-HER2 therapy. For those people who have, let's say, triple negative breast cancer, who are who've been treated per protocol. Let's say they've had chemotherapy and they need to take their next step surgery in short order. Those people are able to get their surgery, but they may not be able to get reconstruction if they have to, or they choose to have mastectomies. Those reconstructions will be done later. The reason why the doctors don't want to perform long surgeries is because the longer you're under anesthesia, the more suppression of your immune system, the more exposure you have, the more PPE that your surgical team uses, the longer you need a ventilator, the more likely you might need blood for a transfusion, and the more likely if there was a complication that you might yourself need to go to the ICU, which you don't want to do. So in order to keep each person as safe as possible, we're trying to postpone surgeries whenever that is possible. And if it's not possible, to minimize the extent of the operation. So it's at least an anti-cancer operation, but with a plan of doing reconstruction later. Some places may be able to put in a tissue expander, or basically a placeholder to hold the area open and to give you at least some shape in the time that you're waiting. That may not be possible. Other people's plans have been shifted where instead of going right to chemotherapy, they may be postponing that with anti-estrogen therapy, because the doctors may not want you to be immunocompromised with chemotherapy. Chemotherapy does, knock down your immune system, making you more vulnerable to infections such as the COVID-19 virus. So that's why some people have had changes in their treatment that way. And when it comes to radiation therapy, some patients might proceed straight on to radiation if they have significant disease in which the treatment has to happen within a reasonable period of time, let's say a month or so, in order to expect the greatest benefit. For example, people who have triple negative breast cancer. But for most other groups of people, their radiation may be postponed because of the pandemic. But in the meantime, they may be put on anti-estrogen therapy or anti-HER2 therapy as a holding pattern. For those people who are not diagnosed with breast cancer, but who may be at high risk for having breast cancer because of a strong family history or because of a known inherited high-risk mutation, those people, may see an interruption of the close surveillance that they're used to having, this whole schedule of close surveillance that they've been sticking to along the way, and that schedule may be disrupted by the whole crisis, the COVID-19 crisis, because we're trying not to have people come in and get mammograms, even high-risk surveillance mammograms at this time, if we can postpone it just a little bit, like a month or 2 months, to keep you safer. When the mammogram centers do open back up again, they are most likely to take those people who are at high risk, who are on a very active surveillance program and want to keep the rhythm of and the schedule of their surveillance on in order. So those of you who are in that situation will most likely get in sooner than later to get back on your schedule. Of course, the physical isolation that so many people are experiencing during this COVID-19 crisis, not just basically everybody, but for those people who have been dealing with a breast cancer diagnosis or the threat of a diagnosis, or they were in the middle of a workup to see if they were at high risk, you can feel alone anyway. And then with the COVID crisis, people are more physically isolated. If you've gone through treatment and you're immunocompromised because of chemotherapy, most people want to protect you and have you stay on your own. And that's obviously safest for you, but it's physically isolating. And along with physical isolation can come a lot of emotional or social isolation, which is something that we can, that we help we help people with through breastcancer.org's programs on, we have all kinds of content on all these issues. We also have discussion boards where people connect with each other on our breastcancer.org community. where you can feel more socially and emotionally connected, despite all the physical isolation. Our audience, from around the world, people have been experienced the same challenges no matter where you are. So it sort of made the world a small place. And we at breastcancer.org have met this surge of new need in all kinds of ways through, new articles and videos, podcasts, all kinds of content. Of course, our goal is to provide the, answers, information, support at this critical time. And as Dr. Reingold said, things are changing on a daily basis. So even some of the content that we have, we're always trying to revise it to reflect the newer advances so that people have that timely, actionable information. There are a lot of people who reach out to us who are caregivers that are trying to help the person going through all this get better, get more continuity of care, despite the fact that access to doctors might be limited, access to medical services might be limited. A lot of your care might be done through telemedicine or much more remote methods, and you really miss the closeness and the importance of your relationships with all kinds of people. You're in your immediate support network, your doctors, your family, your friends. It's a lonely time, and just the feeling of getting a hug from somebody is one of those things people crave that they can't have, the simplest and most important things in life. During these periods of time when you're waiting to get your care back on track, there are things that you can do to feel more empowered and to be more ready to roll when the restrictions lift. So, for example, genetic counseling and genetic testing, which is really important to share it off to your whole community and your mission, is such an important thing to accomplish in your evaluation for breast cancer risk and a breast cancer diagnosis. And that is one area that you can move forward with during the pandemic, to make sure that you have the benefit of genetic counseling and genetic testing, even if it's not delivered in the usual way. So for example, most of the genetic counselors in our hospital and the mainline health system in the Philadelphia area are doing telemedicine genetic counseling. And a kit is being sent to the individual, and the sample is obtained through the swab of the, the inner buck, the inside of the mouth with the swab rubbed against the wall of the mouth in different areas and put into the solution. It's not as easy to get the blood sample to send off for genetic testing. But the genetic testing companies can do an accurate test on the swab test as long as they have a good sample. And they usually tell us if the sample was insufficient and it needs to be repeated, let's say through a blood sample. So getting genetic testing during this period of time is an important step to accomplish. Getting healthy and strong, like, getting physically as strong as you can, improving your nutrition is something that you can do during this period of time, even though your access to good food might be constrained. People offer to help you by making meals. That's very nice for them to offer. You could be specific and say, oh, I really would love to have, let's say, a vegetable stew or a casserole or some, basically ask for things that may be more healthy. And generally it's important to ask or accept food that can be heated up or cooked, because the virus hates heat. And when you heat up your foods, it is likely to kill the virus and kill anything that might be on the outside of the casserole or the dish that you've accepted from a loving family member or friend. Less safe foods to accept from other people if they're offering you would be things that don't get reheated or get cooked, like salads, sushi, and deli meats and things like that, where you're not going to reheat them, recook them, and you're just going to use them as is. I'd recommend against that. You just don't know what is going on in the people's home when they prepare these foods and deliver them to you. I do think it's going to be a big transition for people who've been who've been actively seeking care for breast cancer and who've been physically isolated. It's a big transition to go from that isolation back out into the world again. Even to visit your doctor in the hospital can be met with dread and anxiety. So I think it is important to really understand how you can protect yourself in that environment as you move out of your home and start interacting with other people and going to new places. I know in the hospital, and I'm sure Dr. Reingold would agree with me, is that, generally speaking, in the hospital, while there are COVID patients in hospitals, hospitals are a controlled environment. Like, they check everyone at the door with a temperature check and questions about where you've been, who you connected with, and if any exposure to people with COVID-19. Cancer centers are very far apart from emergency rooms and intensive care units where the COVID patients are. In the hospital, we are trained to handle these things in the safest way possible. We all, and I got ready to go here, we all have our masks. And these are really important because this particular mask is a surgical isolation mask. It's not a N95 mask. We wear this when we're doing regular interactions with patients. The masks do protect you from the patient. They protect the patient from you, and they also protect you from you because you don't want to be touching your face. And when this is on you, you're less likely to be touching your face, the places where the places where the virus likes to get in, the eyes, the nose, and the mouth. And so I would always have a mask with you or be wearing a mask when you go out and about, particularly those people who are immunocompromised. I wear rubber gloves because I wash my hands a million times a day. My skin is about to fall off my hands, so it's a way for me to protect my hands from all the harshness of the chemicals that we use to clean our hands all day long. And of course, social distancing, we provide that in the hospital in waiting room areas where we make sure that you are at least 6 feet away from people who are also here to get their care. Even if you're with family and friends, I think it's important to know that one significant source of getting infected is from the people in your life around you, family and friends. You just don't know who's been where. And as everyone knows, you can catch COVID from anybody who has the virus with or without symptoms. So, and we just don't know who does or who doesn't have the virus. So it's better, we like to invoke the precautionary principle, which is better to be safe than sorry, and keep yourself as safe and well as possible as you make your way through this whole crisis. So I think I'll stop there and have people submit questions, or happy to address anything that comes of mind.
Thank you, Dr. Weiss. And Dr. Weiss and Dr. Reingold will be taking questions. You would type them into the chat, and then we'll be addressing those. So a question came in, and I think this one is for Dr. Weiss. There's been a lot of press that COVID-19 can attack your heart. For patients who took Herceptin and have to have echocardiograms every couple of years to check their heart valve function, is there an increased risk or concern with COVID-19 infections?
Well, that's an excellent question. And as Dr. Reingold said, this is a new disease, an infectious disease, and we're learning a lot more about it every day. Initially we thought it was only a pulmonary infection, like, respiratory infection in the upper airways and the lower airways and the lungs. We've since learned that it can affect your blood clotting system, and it can affect it can cause clotting and problems with your vessels and pulmonary emboli and things like that. And it can affect your heart, and it can cause strokes. So, and I think the way to approach this is to say that everybody is at risk for COVID-19, some more than others. And on top of that, some people are at higher risk for having complications if they were to get COVID-19. compared to other people who seem to maybe get it but are asymptomatic or have only mild to minimal symptoms. We know that the average age of a woman getting breast cancer is 62. So one risk factor for having complications from COVID is being over 60, especially being over age 65. So by age alone, about half of the people with breast cancer are considered in the higher risk pool of people. And then add to that any other underlying condition like diabetes, heart disease, lung disease, and or any other problems with blood clotting or things like that that may put you at high risk. And so those people do have to be extra careful. And I think that would include people who may not have heart disease, but took treatment that may have made their heart a little less strong or a little less able to handle the challenges that you could experience if you had a full-on COVID infection. Just because when you get sick with COVID and you get high fevers, your body has to work super overtime to manage and to stay alive and stay healthy and survive it. And that can put someone's lungs and heart, it can strain your whole body, including your heart and lungs. So I think I would take extra steps to be extra careful to protect yourself against getting COVID-19 if you had treatment that could have affected the health of your heart. It could be adriamycin, it could have been Herceptin or medicines like that. Plus there are medicines that people are on now that can affect their lungs, like the CD4/6 inhibitors can cause interstitial lung disease. And so we want to make sure that people who are on those medicines are being extra careful. Now, during this pandemic, some of the medical oncologists may recommend that you switch from one type of chemotherapy that may be more likely to suppress your immune system over to another that may be effective with less of that type of side effect as a holding pattern until we learn more about this virus, how to avoid the virus, and how to treat the virus.
Thank you. There are a lot of questions coming in privately in all different ways, Dr. Reingold, for you, as you can imagine. So it might be a series of questions coming your way. You started to talk a little bit about masks. So now the question is, we have these, you can order fabric masks, you can get what Dr. Weiss is wearing, what mask, N95s, what should we be wearing generally, or if we're going for chemo infusion, what is really recommended? What's the right thing to do?
Well, I perhaps may let Dr. Weiss speak specifically about the question of going in for an infusion of some kind. I don't know if that requires a higher level of mask and what the recommendation is for that. But I think there are a few things to say. First of all, despite being a rich country, we seem to have started out at a disadvantage with regard to enough masks of different kinds and have had to give priority to frontline healthcare providers, particularly with regard to the N95 masks, because they're at very great risk of being infected as they care for sick patients. So the general belief among those of us in public health is that you don't need an N95 mask when you're out and about. I would say that N95 masks really should be properly fitted to your face, number one. Number two, they're actually somewhat uncomfortable to breathe in and wear for prolonged periods of time. And many people don't wear them correctly because of these problems. And we want to conserve the N95s for people who are in really risky situations. But Dr. Weiss may have some information about someone coming in for an infusion or something. But I think outside that setting, the current recommendation, as many people will know, is that, for example, here in my county, you're not allowed to go out without a mask or a facial covering. And so a surgical mask or something of that kind is believed to be sufficient, but many people are wearing other types of face coverings made from different fabrics. Some suggestion, perhaps nylon, an extra layer of nylon underneath the cloth might be more effective. But the primary reason we want people wearing masks when they're out and about is to reduce the chances that if they are asymptomatically infected, that they will transmit the virus to other people. Do the masks also offer a degree of protection to the person wearing the mask? Well, we hope so, but I think the scientific data are really quite limited about that. The reality is that, you can buy different types of cloth or other masks online. You can make your own, but primarily we want to make sure that your nose and mouth are covered when you're out and about in proximity to other people. And whether one type of mask or another is going to be radically more effective than the other, I think, frankly, we don't really have the data. But Dr. Weiss may have a comment about in the clinical setting when a patient comes in.
Yeah, well, thank you. So I totally agree that the N95s are being reserved for the healthcare professionals who are directly taking care of COVID patients. For those of us who don't have direct care or are not doing procedures that would aerosolize the COVID virus, we are using these surgical masks called isolation masks, which you may be able to get. And you put them on with these loops and you put them over your nose and your mouth, both, and you put them behind your ears, and you also take it off with the loop also. If you don't have access to the mask, then you can use fabric. And the recommendation by the CDC is to use 100% cotton that's got 180 thread density or higher, that is basically tightly woven enough to be an effective filter to catch the droplets, either invisible or visible. The very tiny or the larger droplets that COVID tends to live in. These droplets get into the air by people breathing in and out. For people who have COVID, they are breathing heavily. A lot of times they're having trouble breathing, so they might be, really, propelling their breath out when they exhale. Also, if they cough or they sneeze, and when they do that, the spray effectively that comes out of them can go way beyond 6 feet, actually 6 to 12 feet, but even the breathing can drift a few feet. So you want to have some level of protection. What I tell my patients is double up. So if you have a tightly woven fabric like a bandana, fold it in half and tie it over your nose and mouth. If you have a longer scarf, just wrap it around twice over your nose and your mouth. Make sure it's tightly woven. To know if it's sufficiently tightly woven, you can take a flashlight, put it up against the fabric, and if it's tightly woven, not all the light will come through, whereas if it's a gauzy kind of a scarf, the light goes all the way through. That's not good enough. And again, you want to either wear it out or have it available to you. Where we are also in the hospital, you're supposed to wear a mask at all times. Sometimes I see people not wearing a mask, but they're supposed to. In grocery stores, the places that are preparing your food, they should be wearing masks too, particularly in places where they're preparing foods that are not going to be heated or reheated, like the deli counter, the sushi counter, the salad area. Even if they've removed the salad bars, they are still preparing those foods. I think that they should be wearing masks, or I recommend that you don't buy that stuff right now, or make it yourself. I do think that a mask also gets you in the habit of being more aware of this whole issue, but we don't want it to give you too much confidence that now you're not going to, the mask alone is not enough. You still need to do the social distancing. You still need to wash your hands. You want to wash your hands after you take the mask off. You want to make sure the masks are clean, that if it's a cloth mask, you're washing it and fully drying it, because they don't work as well when they're wet as when they're dry. And it also helps to have a mask on to keep you from touching your face. The thing about masks is that they do cause some they can cause some fogging of your glasses. So you do need to put it on and put the metal piece or tight against your face here if it's got a metal piece, and put your glasses on top. That helps prevent the fogging. And we do recommend that you don't wear contact lenses right now, because people who wear contact lenses are touching their face repeatedly and their eyes repeatedly. It's better to switch over to glasses right now. The reality is that you can, we're talking about, masks to cover your nose and your mouth, but eyes are also a place where people can get exposed if someone's coughing near you. I mean, that it's not as much of a entry point, but it's an area of concern. So if you do wear glasses, that's maybe a little bit helpful. I have safety glasses or even goggles. Some of us wear goggles if we're doing anything close to a patient for that reason. Maybe you have safety glasses in the basement that were in the shop, or N95s from the past. We found a few down there in my basement to be helpful. I do want to say that it's going to be tough for all of us to transition into the world back again after this is, sequentially, this is not going to be over for a while, but as restrictions ease up, we're all going to have to learn how to get back into the swing of things and learn how to interact with other people. Generally, everyone thinks that they themselves are clean and okay and healthy, and you always doubt someone else's, if someone else is clean and healthy, if you could catch something from them. When the reality is that any one of us could have it, and even in the absence of symptoms. And we're going to have open conversations with people that we connect with to say, I'd like to hang out with you, but where have you been, and who have you been hanging out with, and are you sure you're okay? And just so that you can feel comfortable in trusting what someone else is doing to be safe and healthy as well. In my family, I'm from a big family, and we haven't seen each other for a long time. My husband and I are both doctors on the front line in the hospital, and our kids don't want to see us right now. So we have 3 kids that are sort of avoiding us completely on the other side of the window. And my mother, who's a breast cancer survivor, 90 years old, she's completely isolated. We bring her food and things like that, but we see her at a great distance. So we all look forward to a time when we can hang out together, hug each other, and be safe and be well. But I just want to say that there's going to be a big transition between now and then, not just when stores are open and the things that the news is focused on, but emotionally and socially. What's it going to take for us to be comfortable hanging out with each other again, and sharing a household, sharing a party, or going out to dinner with anybody, having people over? It's going to require a lot of straightforward conversations where people don't get offended when people ask about this. It's very touchy.
Thanks. 2 questions for Dr. Reingold. One on antibodies and one on, there's this an article in today's New York Times that's talking about estrogen therapy, that maybe perhaps, and tell us what the validity is, that women seem to be faring better. I mean, many of us on the call today are cancer survivors, and I don't know if that's pulled out for the study, but there's a lot of talk about estrogen, injecting estrogen. Can you talk a little bit about this estrogen therapy, and then an antibody question after that?
So let me take the second one first. And again, Dr. Weiss may have more information on this than I do, but I would be a little hesitant to conclude that the difference between men and women with regard to this virus is estrogens. Men are the weaker sex in general, and have worse outcomes for virtually every disease we know of, and including many infectious diseases. So A, this is not unusual for an infectious disease, but B, whether estrogens are at the heart of it, and whether pumping estrogens into men or women with COVID-19 will improve their outcomes, I remain skeptical about. I understand people are desperate to give good treatment and try and reduce severe illness and death, but I'm quite skeptical of that link, if you will. But Dr. Weiss may have more information on that than I do. I think the issue of antibody testing is something I am comfortable talking about. And fundamentally, these blood tests to look for antibodies are extremely useful for a whole host of different infectious diseases that we study. And there's enormous work being done to develop the good antibody tests. They are not ready for clinical decision-making. None of the tests, even the ones approved by FDA. So I don't believe they should be used for making a diagnosis that somebody has COVID-19. They're really a research tool at this point. They're of great help to epidemiologists, even given the limitations of the tests. They do help us understand something about how prevalent infection has been in the community, even asymptomatic infection. So we think they're useful for people like me doing studies of populations. And the unanswered question, frankly, is whether detecting antibodies says anything about whether you're protected against infection in the future. And I know a lot of politicians and leaders think we're going to start issuing cards based on your serostatus, your blood test result, that you are immune, that you can safely go back to doing X, Y, and Z. I think research is needed to see if that's a correct statement and whether we can really rely on the antibodies being detected, and if so, for how long. They might confer clinical protection. They might provide protection for weeks or months or years or maybe for lifetime, but we just don't know yet. So this is really an area in need of a great deal more research. So I would say at the moment, the antibody test is something people like me are using to study populations, but I think the use in a clinical setting or for saying who can safely go back to work and go outside and not wear a mask and doesn't need to worry, that's quite premature.
Dr. Weiss, what about oral chemotherapies? Are they also immunocompromising for patients?
Yeah, well, so, chemotherapy is only given to people who need chemotherapy because of a serious illness like breast cancer or another type of cancer. And so in the setting where you need chemotherapy and you're talking to your oncologist about, okay, I need chemotherapy, what chemotherapy should I go on at this time when I can't get in to see you very much and I can't be monitored as closely? The oncologist may say, well, rather than you come into the cancer center and get an infusion that takes several hours to get, and that has significant potential effect on your immune system, how about we give you a medication you could take at home so you don't have to come in here and you don't have to be exposed to other people, and that may have an effect on your immune system, but not quite as significant an effect. That might be a decision that you make together with your doctor, weighing the pros and cons during this temporary period of time, let's say a month or two, when you might shift to that oral route rather than the intravenous route for all those reasons. So any chemotherapy can knock down your immune system, some more than others, but it's not just that, it's also that your doctor doesn't really want you in the hospital where you're exposed to other people and you're there for hours at a time. And you have a higher risk of getting sick from a stronger chemotherapy. If your immune system's down, you're more likely to get sick from any type of infectious agent, not just COVID-19, and you're more likely to get sicker, have more complications from an infection if you do get sick. So that's why they make that recommendation.
And what about if someone's on Coumadin? And how is that affected with what they're talking about with blood clots and all that?
I don't really know enough about that. I know that we're learning as we go, and that we are really hearing a lot more about the COVID-19 infection being associated with a high risk of making blood clots in your body, of thrombus, when blood clots that fill up your veins, and even some arterial blood clots. And how you manage that with a blood thinner like a Coumadin would depend very much on your particular situation, and your own, the best form of anticoagulation in your particular situation. And Coumadin is one of multiple agents that a doctor can use to help people who have a blood clotting disorder or have developed that with COVID. And I'm not aware of its role in a preventative setting. And back to what Dr. Reingold said about the difference between men and women, we also know that men are much more dependent on sharing their lives than women are relative to their emotional health and their longevity. Like in the cancer arena, there was a fascinating study out of Harvard that looked at men and women who have the top 5 types of cancers, how long they lived, if they were married or not. And it turns out that the men who were married had a greater survival benefit from marriage than they did from chemotherapy, and a much greater, and women did also have a benefit, but it wasn't as much as it was for men. So I do think that the social isolation for men and for women is unhealthy and upsetting and depressing and can be lonely, and maybe more for men than for women. But it's a call to action, and we need to find ways to be socially connected, if it's Zoom calls or phone conversations, or you take a walk and you have your friend on the phone and you're like walking together in parallel but not in the same area, or you're walking together at a distance, or you're finding ways to share funny stories or tell jokes or whatever, write a letter, send a meal, all kinds of ways that you can stay socially connected. So important at this time.
A question, a lot of people talk about this, and we've heard it a lot, about radiation and scarring in the lungs, and how is that affected by COVID, or risk or recovery and all that?
So when we do radiation therapy to the breast, we treat the breast at an angle. We come to each side of the chest and treat the breast at an angle, and there's a little bit of lung that can be underneath the chest surface that may be in the treatment field, and that may produce a trace of scar tissue that could be seen on a subsequent x-ray. Usually it has no impact on the person's breathing or exercise tolerance. And it's unknown if that teeny bit of scar tissue would make somebody more vulnerable to having a complication from COVID-19. We don't have the answer, but we do know that in public health and in the world in general, there's the expression, it's better to be safe than sorry, the precautionary principle, which I invoke all the time. We don't know, but I do think that if you are under treatment for breast cancer, which could be, chemotherapy, it could be radiation, it could be surgery, it could be anti-HER2 therapy, anti-estrogen therapy, or some combination of those things, or together or in sequence, that you need to be extra careful to protect yourself from getting the virus. Because you don't want to get sick at all, and you certainly don't want to be sick at a time that you might not be you're fully strong and healthy, when you might be at risk for having more complications.
Thank you. I mean, a lot of people on the call are already living or have recovered from COVID-19. So some of these questions, just to keep in mind, might be people who are not only trying to prevent it, but also to get a sense of what the future might look for them also. So as the questions come in, I'm hearing some of those comments too.
I would also just wait one more thing. One thing that's to really mention is that if for people who have diabetes, it is very important to take care of yourself and to keep your sugars as closely controlled as possible. Anybody with diabetes is at high risk for having complications from COVID-19. And we don't know yet if, perfect control is going to protect you from the worst, potential complications. But it just makes sense to try to be extra careful to stay as controlled as possible, and also to stay away from people who may be to be sick. Also, I would say that if you're stuck at home and not getting out and about, it is important to be exercising while you're at home, that you're not just sitting around. You want to be breathing fully and expand all areas of your lungs, and getting that exercise and staying in shape, doing the stairs, or following classes online. There are plenty of free classes online to follow, to be exercising in place, or do yoga, or to do stretching, or to do whatever, taking a walk in a place where you're not going to be up against other people. So, staying healthy and keeping your lungs full, regularly functioning and fully aerated is a good idea.
Thank you. Dr. Reingold, there's a lot of discussion, and Dr. Weiss touched upon it a little bit when we talked about food and heating things up and protecting ourselves with food. But there's also a lot of information out there that it doesn't really survive on surfaces. How much are we supposed to clean? So if we're talking about fruits and vegetables, are we supposed to wash them with soap and water? What about containers? What's the practical way of us dealing, especially for those who are living not isolated, but multiple family members? So you could have 6 to 8 people living in a house, and it's not practical to wash everything. What's really important, and what is something that maybe we don't have to do?
So this is another area of a lot of ongoing research. First of all, there have been some laboratory studies that look at detectability of the virus for varying lengths of time after it's been put on various surfaces, different metals, plastic, glass, paper, cardboard. It doesn't survive very well on paper and cardboard. It survives a little better on plastic and survives even longer on things like stainless steel. And when I say a little longer, it's been detected after being put onto stainless steel at least several days later, whereas paper and cardboard tends to be more in the range of less than half a day. Those are experiments that speak to the biological plausibility that you can get transmission of the virus through these packaging materials or things in the environment. And we absolutely want to make sure that people are doing a good job of environmental decontamination. Lots of the things you've heard about in the news the last few days that shouldn't be applied to the body can in fact be applied to surfaces in a safe way and reduce viruses on countertops and things like that. So we do want people to do that. I think the issue of food is a very perplexing one for many people. I want to begin by saying that there's really no evidence at this point of transmission of this virus on food items. So the risk is theoretical, but it's certainly reasonable to be concerned. If I have the virus on my hands and I prepare a food that you don't heat up and then you eat, theoretically, or it's on the packaging that someone brings to your home, theoretically it could transmit the virus. I'm just saying we don't actually have evidence that that's happening. But certainly for people who want to be extra careful, I think your recommendations about, or Dr. Weiss's recommendations about foods that you can reheat are perfectly good ones. Some people I know, if there's a delivery, will wipe the surface of that container wearing gloves and wipe the surface and try and minimize the chance that anyone could have deposited virus on the packaging or on the food itself. I think the real problem is with fresh fruits and vegetables. And things that are basically solid, like an orange or an apple or a pepper or a tomato, virtually all the things that you could potentially buy will in fact inactivate this virus. So you can cleanse the outside of those types of vegetables in a way that's really not possible for leafy green vegetables, for example. I don't have a good solution in terms of leafy green vegetables, my own assessment is that people certainly can provide themselves an extra level of protection by thinking about the packaging and the fruits and vegetables. But as I said, at the moment, we don't really have evidence that people are getting infected through contaminated food with this virus. So just keep that in mind.
Thank you. Dr. Weiss, there's concern about lumps maybe that were found and there's lump growth and they don't have access to a doctor at this time. Is there any recommendation regarding food or supplements is there anything that slows the growth of a lump that we could do on our own?
Well, so just because of the COVID-19 crisis doesn't mean that we're not evaluating people who have something of concern. Because we're not doing routine mammograms right now, we're not, that's not a general source of concern right now because people are not coming forward with a mammogram abnormality. But if you feel something or you see something that's not normal, that's different, that persists, that worries you, you can absolutely get access to the doctor who, through most likely the first step would be through telemedicine. But if if you and the doctor together are concerned that it could be something significant or that you want to have it checked out further, we absolutely do diagnostic studies right now, ultrasound, mammography, MRI scanning for people who have a finding. The main thing that has been postponed is screening mammograms in people who are without symptoms that were just your regular screening studies. But what we are seeing actually right now at a national level is underutilization of the medical system by people who really do have urgent or emergent problems. A breast lump is not an emergency, but I'm just making the point that people are so afraid of going to the hospital for anything other than COVID that they're not coming in for problems that are emergencies that need treatment, like stroke-like symptoms, or maybe symptoms of uncontrolled diabetes, or people who have heart attacks, or people who have fevers for other reasons. Everyone's trying to stay away from the hospital, and you do want to stay away if you can stay away, but if you have something that's significant, absolutely call your doctor. Start out with a telemedicine evaluation, explain what you're concerned about. With a video component, you can actually show a doctor many things that might be visible by that method, and then take it from there.
Okay, I know that Dr. Weiss has a hard stop at 3 o'clock, but I just had one more question for Dr. Weiss and then one more question for Dr. Reingold. So Dr. Weiss, is there a sense of when we might be rescheduling preventative mastectomies and when that might happen?
Yeah, so there is a backlog of people who are waiting for surgeries, including people who are at high risk and who have made the decision to have prophylactic removal of breast and then usually reconstruction afterwards. Your doctor knows who you are, but you can also remind them that you are really waiting to go. There might be a window of time where it's best for you to have that procedure. And I'm sure they're going to put you make you a priority, but realistically, it probably won't be until the summer. And it depends on where you live, because they will get people. The first people to get into the operating room are going to be people with cancer who need their surgeries done. It might be people with cancer who had mastectomies but couldn't have reconstruction and went home flat-chested and are very sad about that. And they're also on the list of people who are waiting to have their procedures. But for people who don't have cancer, but who are at high risk for cancer, who are waiting to have these procedures, you're very important too. And I would just talk to your doctor where you are about how to get on their schedule. Not just the breast surgeon schedule, but the breast reconstruction person's schedule, the coordinated team. And meanwhile, there are discussion boards on breastcancer.org, or people like that people who are waiting for these treatments or experienced a change up in their treatments and are feeling uncertainty from that and are giving each other a lot of important support.
Okay, I said it was your last question, but I keep getting this question over and over again, so I'm going to ask it quickly, and I can talk very quickly, but what are the effects of estrogen blockers that breast cancer patients or survivors are undergoing have on the body, and are there increased risks related to COVID?
So, about 2/3 of people who have breast cancer have hormone receptor positive breast cancer, for whom, hormonal therapy can have a very important role. And there are millions of people out there that are taking it. And right now, we don't know of any connection between being on anti-estrogen therapy and having a higher risk of getting COVID or having complications from COVID. But I would just say we don't know, because this is, again, a new disease. These are not things that we're tracking in any systematic way right now in most places, but it's certainly something that we'd love to learn more about.
Thank you, Dr. Weiss. And Dr. Reingold, one more question for you, but for all of you that are still on the call, if you have remaining questions, please feel free to submit them to us. We will get you the answers within the next day or two. But Dr. Reingold, before we sign off, and thank you, Dr. Weiss, do we have a false sense of security when we're wearing a mask? When we go into a supermarket, a grocery store, or somewhere else, everyone says, oh, 6 feet away, but if I'm wearing a mask, I can slide by this person to get down the aisle. Is the recommendation for 6 feet away even while one is wearing a mask?
So first of all, let me see, I did see a question asking for clarification about eating apples, tomatoes, peppers if you wash them. My own advice would be yes, that's perfectly reasonable. It's a reasonably safe thing to do, and I wouldn't have any hesitation about doing that. With regard to the social distancing in a place like a supermarket or a pharmacy, certainly the ones I attend, they're pretty well set up at this point to reduce crowding and try and reduce people coming close to each other. But admittedly, if you're going down the aisle to get something and put it in your basket, you could come within less than 6 feet of someone. So my own view is that, if you're wearing the mask properly and it's a reasonable mask, that I wouldn't get terribly anxious about having to walk past somebody in the aisle if you're in the grocery store. But obviously maintaining distance is one of the factors we think is protective. So, I think in the real world, sometimes it is necessary to get a little closer to somebody as you're navigating your way around a store.
Okay. So everyone, thank you so much for your time. This is just a reminder that Share It is here for you or your loved one, whether you're living with cancer, at risk for breast or ovarian cancer, or a family member or a friend taking care of someone in your home, or even at a distance. Share It's here for you for any questions that you have. We're providing emotional support, mental health counseling, and up-to-date health information. And everything is private, confidential, and one-on-one. We also have a huge peer support network. So people like you, women like you who are on this call, can provide your help to other women who are going through this. This is a tremendous opportunity for us to be a community virtually. While we look forward to being together again physically, we can remain together online. So please feel free to reach out to us anytime, shareshare.org. Again, breastcancer.org is a huge resource for you for understanding a lot of the terminologies that came up today, and any questions that you have that are available every day, all day, as is Share. Thank you, Dr. Reingold. We know that someone with CDC experience is what everyone wants to hear. So thank you all, and thank you for your expertise, your time, your everything, your concern. I mean, we just want to stay healthy. We want to get past this, and we want to go back to normal life. So we wish everyone here continued good health. And if there's anything you need, feel free to reach out. We're here for you. And thank you.
Thank you.
And wash your hands.
Wash your hands. A lot. Okay.